From Bangalore, we have this evening Dr. Devi Shetty of Narayan Hridaya, and with us in the studios is Dr. B.K. Goyal, who is Dean and Chief Cardiologist of Bombay Hospital. Thank you, Dr. Goyal, for coming in. First to you, Dr. Devi Shetty, how complicated is this procedure given that the Prime Minister is 76, it's his second bypass surgery, and he is also a diabetic?
Any heart operation is a major operation, and second time heart operation in a person of his age will obviously be slightly more complicated than a regular operation. There are no minor operations on the heart. Yeah.
But can you tell us more about the operation itself? How long is it likely to take, and what are the risk factors?
Yeah. Arnab, it's not right on my part to talk about the Prime Minister's operation because, it's not ethical on my part. But in any case, a person of his age who had an earlier heart operation, who is undergoing a second operation, obviously the procedure time may be anything from 5 to 10 hours. So it will take a lot of time to get into the heart, because during the first heart operation, it's very easy to get into the heart. Within half an hour, you can start the main operation. Because it's a second time operation, it will take much longer time. But procedure time generally takes about 1 to 1.5 hours. And because he is diabetic, obviously the recovery will be much slower compared to other patients. So on the whole, it is not a simple, straightforward bypass he would have had about 15-20 years ago. He is much older. Obviously, his recovery will be much slower.
Dr. Goyal, how active is a person or a patient after such a surgery?
You see, once the surgery is over and patient has completely recovered, then he is totally active. There is no lacuna in his activity. Because once the surgery and grafts take place, then the circulation of the heart resumes and the person is totally fit. And I think he can be fit within next 3 weeks.
So, but, let me ask you the straight question here. Prime Minister Manmohan Singh, though it's not been officially said, he is still the prime ministerial candidate of the UPA, and many people do believe that he can have another term as Prime Minister. Now, straight question to you, Dr. Goyal. After a second bypass surgery, is he completely capable of all the regular day-to-day function? Prime Minister's job is extremely strenuous.
No, I have no doubt that the second bypass surgery, if it goes through well, which it will go through well, then after bypass surgery, the man is totally fit. And he can be fit for next 10 years.
This is not unusual what you're saying.
It's not unusual.
That he's having a second bypass. That also after 15-16 years.
Statistically, 90% of people have 5 years very active life. 75% of people have very active life for 10 years. So if it is just one 5 years term which we are talking, I don't see any problem in that.
Right, because I just wanted to come to you there, Dr. Devi Shetty. In a situation such as this, we hear that 3 blockages that the Prime Minister has in his arteries. Would he be facing a lot of discomfort? Because this seems to have happened all of a sudden. He went through the examination on Tuesday. Then this decision to have the surgery tomorrow was almost taken last minute, it appears, very quickly. So could something worrying have necessitated this?
A patient who had a heart operation once in the past, he is obviously being monitored on a regular basis, and nothing comes as a surprise. I'm sure these blockages were there. And talking about the quality of life following a second operation, there is really not much of difference between the quality of life following first operation or the second operation. It is an event which happens in the life of patients who had one operation. We all have to understand that bypass grafting today is the commonest heart operation. It's a very standard operation, and outcome of surgery is excellent. The outcome and his long-term lifestyle and how strong he will be depends not on the second heart operation as an event, but how strong his heart muscle was before the operation. So looking at the way he has been, I expect him to have an excellent long-term result.
That's important, especially because from all visible accounts, as we've been reporting, the Prime Minister has had a very hectic schedule, and he seemed extremely comfortable till recently in all his engagements over the last few days. So,
if we are talking about the pain now, I don't think he must be having pain, because they must have given him drugs if he was having pain, and he must be quite comfortable.
Absolutely, and the doctor, yes, no, you were saying something.
No, and the doctors will ensure that he is pain-free, and during surgery, though as my friend Devi Shetty pointed out, it may take more time, because the sternum has to be opened, and that takes time, because it's a redo operation, redo surgery.
I see.
But that is all right, but that is all in anesthesia.
Right.
And once the patient comes out of anesthesia and comes out of the operation successfully, which he will be, because the success rates of the even redo surgery is as high as 96%.
I see.
The ordinary surgery, the first time surgery is only 2%. Risk factor, and the second time is 4%. So,
and you, I'm sure you and Dr. Devi Shetty know some of the doctors who are going to be operating on him, especially Dr. Ramakant Panda, who is one of the best in the world. In fact, Dr. Shetty, just on a last reassuring note, you have performed so many delicate cardiac surgeries yourself. You expect that by this time tomorrow that the Prime Minister will be well on his way to a systematic recovery.
I'm sure he will.
Dr. Devi Shetty.
Yeah, I'm sure he will be.
Dr. Devi Shetty and Dr. Goel.
yes.
Touchwood. Prime Minister will be fine.
Yes.
Thank you very much.
And our all good wishes for his very speedy recovery.
Absolutely. To
our
his
Prime
family,
Minister, yes.
to his family, from all of
for
us.
For family and himself and everything, everyone, for the nation.
Absolutely. At a very critical time.
At the critical time is most important.
That he's up and about. Well, he will be, as you said yourself, it's like the tonsillitis of the 21st century of heart procedures now. Bypass is not as complicated as some think. Thank you very much.